Well, good evening, Market America. It's a great pleasure to be here and a great opportunity to really speak about prime joint support formula. Sandra, my wife, and myself are local coordinators in the Seattle, Washington area, and as the slide says, I'm in private practice in orthopedic surgery, and I really specialize in hip and knee replacement. But quite frankly, it's too late when you need me. Hip and knee replacement is in large part a failure of acting earlier to maintain your normal structure and function in your joint. Now, this is the usual FDA disclaimer, and I want to talk about health and function rather than the things that the FDA talk about. Now, it turns out, if you want to calculate it, your age is roughly proportional in terms of percentage to your likelihood of having a joint problem. So if you're 40 years of age, you have about a 40% chance of having a joint problem. If you're 80 years of age, you have about an 80% chance of having a joint problem. And on average, about 30% of the adult population has a problem with their joint. I keep using this term joint, but what is a joint? It's really any area of our body where one bone moves against another. And it's an incredibly complex structure. We have hundreds of joints in our body, and really anybody who wants to maintain their activity level really needs to have good functioning joints. It's a real challenge for all of us. And it's even more of a challenge if you're faced with problems with overweight or obesity. So naturally, the supplement community has attempted to answer the problems of joint pain. Now, as I stated, the joint is an incredibly elegant and complex structure. And most of us have a sense of this. We have a bone rubbing against a bone, but it doesn't rub against it directly. There's a cartilage surface, a nice cushioning layer on each edge of the bone. To be quite blunt, if you look at, say, a chicken bone, you've seen that glistening cartilage layer. And in between that is a smooth fluid layer. It's called synovial fluid. And that really provides a lubricating layer that's incredibly complex. It's so smooth and so slick that it's 10 times more slippery than a wet ice cube on a sheer pane of ice, if you can imagine that. This works great until things go wrong. Now, with a minor injury, you actually get inflammation, and inflammation helps to heal the joint. But with a more complex injury, inflammation is not enough to heal the joint. Now, as I said, many supplements have been developed, and you might hear of some of them. You might hear friends talk about MSM. They may take that. But the problem with MSM is there's no good research showing that it helps. And even if it does help, it needs to be present in gram quantities, not milligram quantities. So many supplements will have milligram quantities, maybe at 1/100th or 1/1000th of the amount that could even potentially be effective. How about chondroitin? You may have heard of that. Chondroitin is a relatively large molecule and it's not well absorbed. Again, the research is inconclusive, and what you're trying to accomplish in giving somebody chondroitin is you're trying to increase the hyaluronic acid content in their synovial fluid. That's basically the lubricating fluid in the knee. So what about prime joint support formula? Well, we've got pycnogenol, and Dr. Stephen Lamb really talked about pycnogenol. It's a great anti-inflammatory substance. Glucosamine, which is so important for maintaining the structure of the joint. The cartilage itself is made up of the same amino acids that are present in glucosamine. And then finally, hyaluronic acid, which we just spoke about. And this, unfortunately, the fluid in your joint naturally diminishes with age. Now, you need that lubricating layer. And if you come to me, you could come to me as an orthopedic surgeon, have a doctor's visit, and I could take a needle and inject hyaluronic acid into your knee. Or you could take a delicious mango-flavored isotonic beverage and avoid those visits. So let's get into pycnogenol a little bit. Dr. Stephen Lamb talked about it, but I really want to talk about it in terms of your joint health, because that's what I'm passionate about. Now, you may have heard of 5-lipoxygenase or cyclooxygenase 2, big names. What are they and what do they do? These are basically enzymes that convert your essential fatty acids into inflammatory substances, prostaglandins and leukotriene. And leukotriene, again, a big word, but all of you have experienced this leukotriene production. Anytime you sneeze, anytime you've had allergies, that's leukotriene at work. In the knee, it causes inflammation and redness and pain. And so obviously, we would want to limit the amount of leukotriene production. Now, what do the studies show about pycnogenol? Here's an example of a clinical study, and it shows that 156 osteoarthritis patients who were given pycnogenol over a 3-month period of time had a 56% decrease in the severity of their pain. And for most of those people, it meant that they started with severe pain and ended up with no pain. In addition, there have been studies on pycnogenol which show if we measure CRP levels, again, something that we always talk about, CRP, that's simply a laboratory measure of inflammation. The CRP also decreases when people take pycnogenol, again, by about 50–54%. So here we are with Prime Joint Support Formula. It really helps to reduce the inflammation that's associated with aging. It provides that healthy joint fluid. It helps to promote cartilage synthesis and the restoration of your cartilage. And in short, it promotes joint comfort. This is sort of like having a multivitamin for your knee. Now, this slide says Prime Joint Formula versus glucosidone. I think both are terrific products. I use glucosidone in my practice every day. Glucosidone has oleanic acid and boswellia extract and various things that cause acute inflammation to normalize. And so I often give my patients a choice between a pharmaceutical that can cause gastrointestinal bleeding and kidney damage and ultimately death, or glucosidone. But for long-term maintenance of your joint, again, a multivitamin for your knee, if you want friction-free for your knee, you're really looking at Prime Joint Support Formula. First of all, it's Isotonix. We all love the Isotonix supplements. It's the most advanced delivery system short of an intravenous delivery system. And then, of course, we talked about pycnogenol, and it's a tremendous supplement. I'm so enthusiastic about pycnogenol. I think everybody should take pycnogenol in one form or another. And then, of course, we talked about the hyaluronic acid. This is important for maintenance of the synovial fluid. So, in my view, people need both of them. So why Prime? Why is this part of the Prime product line if it's so good for everybody? Well, it's true that I'm one of the baby boomers, and baby boomers really face these joint health challenges. We're all getting older. I'll tell everybody I have the goal of living to 120, so I really have to take care of my knees and take care of my joints. This anti-aging quest is a universal quest for boomers. But who else needs this? Anybody who's a competitive athlete or dreams of being one or dreams of having been one. People who are weekend warriors, that's in the folks who dream. And then the physical laborers. And what's a physical laborer? Pretty much anybody who stands, anybody who spends time on their feet, the cashier, the person who's working in the restaurant, the nurse who's working in the hospital. All of these people are putting excess stress on their joints, and they need this. And really anybody who wants to keep their joints. If you don't want me to replace your knee or hip, you should be taking Prime Joint Support Formula. So what else can you do to maintain your your joint health? This will maintain your heart health as well. It says heart health, but it's great for your knee. It's great for your hip. It's great for your joints. Remember when we looked at those conversion enzymes, it turns out if you feed yourself healthy essential fatty acids, you produce anti-inflammatory substrates. Of course, calcium is also important for bone health. Vitamin D with K2, so that the calcium that you do take goes into your bone and out of your soft tissues. And of course, everyone needs TLS weight loss solution because it's not a weight loss solution, it's a lifestyle solution. So you really need to start this young in order to stay young, and it's a tremendous value. You can, of course, get a 45-day supply, distributor cost of $52.50, but what's available to us now are tremendous savings in terms of these kits. The Joint Health Flexibility Kit, which is a 22% savings, and the Prime Advantage Anti-Aging Kit, which is a 37% savings. So take advantage of these, take care of your joints, and I'll see you when I'm 120.